When normal health isn't enough, understanding sudden cardiac arrest in apparently healthy people. It's a scenario that defies intuition and terrifies families. A seemingly healthy person, no chronic illnesses, no alarming lab results, no history of heart problems, collapses unexpectedly and, within minutes, is gone. The culprit in many of these tragedies is sudden cardiac arrest, or SCA, a condition in which the heart abruptly stops pumping blood effectively. Unlike a heart attack, which is caused by blocked arteries, SCA is usually the result of a severe electrical disturbance in the heart. The outcome depends entirely on timing. Without immediate intervention, brain cells begin to die within minutes. Even if the heart can be restarted later, irreversible brain damage often makes survival without disability nearly impossible. What makes SEA especially frightening is that it doesn't always strike the visibly sick. In fact, a significant number of victims have no obvious warning signs or prior diagnosis of heart disease. Why it can happen to healthy people? Dr. Doan Du Man from the Vietnam Vascular Disease Society explains that a range of hidden factors can trigger cardiac arrest in people who appear perfectly well. Often, these causes are either undiagnosed, extremely subtle, or only appear under specific conditions. 1. Transient arrhythmias, the silent electrical disruption. Among the most common hidden causes of SCA are short-lived arrhythmias, particularly ventricular fibrillation and multifocal ventricular premature contractions. These irregular rhythms can occur without leaving structural damage to the heart, meaning routine tests like ECGs and echocardiograms often show no abnormalities when the heart is at rest. Because they can strike suddenly and without warning, transient arrhythmias can cause instant collapse, cutting off both heartbeat and breathing in seconds. 2. Congenital electrical syndromes, inherited risks you don't see coming. Some people are born with defects in the heart's electrical system. These conditions, known as channelopathies, include Brugada syndrome, an abnormality in sodium channels that can trigger dangerous arrhythmias, long QT syndrome, which disrupts the timing of the heart's electrical recovery, leading to chaotic rhythms, Wolff-Parkinson-White syndrome, where an extra electrical pathway allows the heart to beat excessively fast. Certain genetic disorders, such as Marfan syndrome, primarily affect connective tissue but can also cause catastrophic cardiovascular events like aortic rupture. Many of these syndromes remain silent until they're switched on by a trigger: fever, certain medications, strenuous activity, or even emotional stress. Because they often require specific conditions to manifest, diagnosis may require advanced targeted testing. 4. Transient cardiac ischemia, a temporary blood flow crisis. Cardiac ischemia means the heart muscle isn't getting enough oxygen-rich blood. In transient ischemia, this shortage is temporary and leaves no permanent damage, making it easy to miss. Possible triggers include coronary artery spasm, seen in Prinzmental angina, short-lived blockages from tiny clots or plaque debris, sudden increases in oxygen demand during exercise, emotional stress, or spikes in blood pressure, reduced oxygen delivery due to anemia, low blood pressure, or vessel constriction from cold exposure. While symptoms can fade quickly, these episodes can serve as early warning signs for life-threatening conditions like myocardial infarction, one of the leading causes of sudden cardiac arrest. External triggers, factors beyond the heart. Sometimes the problem isn't within the heart itself, but in the body's chemistry or immune response. Electrolyte imbalances, low sodium, low or high potassium, or abnormal calcium levels can disrupt heart function. Severe allergic reactions, anaphylaxis, can cause blood pressure collapse and trigger arrest. Stroke or brain injury. Certain neurological events can interrupt the heart's rhythm control. Electrolytes, calcium, sodium, and potassium play a vital role in generating the electrical impulses that make the heart beat. For instance, calcium and potassium sit on opposite sides of cell membranes, poised to swap positions during each heartbeat. This exchange triggers muscle contraction and nerve signaling. If these elements are out of balance, the heart's electrical system can fail instantly. Recognizing the warning signs. SCA often strikes without warning, but sometimes the body sends out distress signals in the minutes, hours, or days beforehand. Sudden chest pain or discomfort, especially if it feels like pressure, squeezing, or burning. Shortness of breath without obvious cause. Lightheadedness or dizziness. Rapid pounding heartbeat. Brief loss of consciousness. Because these symptoms overlap with less serious conditions, they're often ignored. Unfortunately, in cardiac arrest, every second counts. The critical golden time. In medical emergencies, there's a term for the window of time when intervention can make the difference between life and death. The golden time. For cardiac arrest, that golden time is frighteningly short, just 4 minutes. Within 3 to 4 minutes, high survival rates if CPR and defibrillation are performed. After 4 to 6 minutes, brain damage begins and worsens rapidly. After 10 minutes, survival with intact brain function is extremely rare, even if the heart is restarted. What to do if someone collapses? If you suspect someone is in cardiac arrest, call emergency services immediately. Make sure the scene is safe. Check breathing and pulse. If absent, start CPR. Place the heel of your hand in the center of the chest. Push down at least 5 centimeters or 2 inches deep at a rate of 100 to 120 compressions per minute. Let the chest fully recoil between compressions. Continue until the person moves, starts breathing, or professional help arrives. Even without rescue breaths, chest compressions keep oxygenated blood moving to the brain and heart, buying precious time. Prevention. Don't ignore subtle signs. Doctors urge anyone who experiences unexplained chest comfort, palpitations, shortness of breath, fainting, or extreme fatigue to get checked immediately. Early detection of arrhythmias, coronary artery narrowing, or thickened heart muscle can prevent many tragic cases of SCA. In some cases, treatment may involve medication, surgery, or implantable devices, like defibrillators that detect and correct dangerous rhythms before they turn deadly. Sudden cardiac arrest is unforgiving, but with awareness, early diagnosis, and rapid action, survival is possible, even for those who never imagined they were at risk. In the fight against SCA, seconds aren't just important, they're everything.